Today, we're going to go over the anesthesia for plastic surgery. Perhaps one of the most stressful topics and feared topics within the surgical field, and obviously applies for the plastic surgery as well. I'm going to talk to you about the different types of anesthesia that you can have. For example, the most simple ones, local anesthetics. Local anesthesia is usually reserved for procedures that are performed, for example, mold removals, cyst removals, things that are little areas of the skin that we are going to be treating or removing. This consists on the injection of local anesthetics that are only working at the area of the surgery. This is very commonly combined with general anesthesia or even sedation to make your surgery more comfortable. But local anesthesia is applied for procedures alone as well, and you can have, for example, your upper blepharoplasty or eyelid lift performed only under local anesthesia. This consists on injecting just the local anesthetic on the upper eyelid and then performing, for example, the removal of the excess skin that you have. There are procedures that can be performed under local anesthesia without any need for either oral sedation or IV sedation or general anesthesia. Now, when it comes to sedation, either oral or IV sedation, it's important that this is performed in an accredited facility, because there are things that you have to monitor even if you're getting this type of sedation to avoid any problems. I want you to understand also that general anesthesia is probably safer than sedation of a least invasive anesthesia. And this is because during the general anesthetics, you have pretty much full control of the patient's airway, which is one of the things that can create the most threatening complications, losing an airway or not being able to breathe. During the general anesthesia, this doesn't happen because you usually have some sort of device in your throat that will help you breathe, usually like an endotracheal tube. So we have full control of this. This won't happen. But when you're under sedation, either oral or IV sedation, there are things that have to be monitored to avoid having a complication with your airway. And this, it's important that you have a trained professional in charge of the anesthesia to give you the appropriate amount of anesthesia so you don't go too deep and you have any sort of complication. There are procedures that we can perform with oral sedation and procedures we can perform or prefer to perform with IV sedation. But for example, a facelift or any procedure in the head and neck is very commonly performed under oral sedation or most commonly performed under IV sedation. This is a state that the patient is able to follow some commands and is kind of awake and breathing on their own, but we can still perform the surgery since the recovery will be probably a little bit easier when you don't get a general anesthetic in terms of nausea, vomiting, and perhaps a little bit faster than with the general anesthetics. Now, there are procedures that require general anesthesia. Most of the body procedures will require general anesthesia because are procedures that are way more invasive, where the patient will have a rather unpleasant experience and the doctor as well. So in these procedures or in this type of surgeries, we prefer for the patient to be under general anesthesia. This way we can perform a better job. The patient will have a better experience, and although the recovery might be a little longer, the overall results will be an optimal result compared to those procedures where you have to stop in the procedure, the patient, is semi-awake and the procedure is delayed and so forth. So I want you to understand that the anesthesia is an extremely controlled environment that is extremely safe. Obviously, it's even safer than driving, and you drive every day. So when you're considering a plastic surgery procedure, don't be afraid of the anesthesia. Come and talk to the surgeon and let them explain to you what's going to happen and follow the recommendations. So now, I hope you enjoyed this video. Give it a thumbs up, share it with your friends. Look more at themagicsurgeon.com for further information on different procedures and different type of anesthesias. And we'll see you next week. And always remember, believe in magic.